Now it's time for today's perspective, and it's been almost a year since Israel began attacking Gaza after the Hamas attacks on Israel on October the 7th. Now, it has led to the greatest humanitarian crisis ever seen in the enclave, where, according to the Gaza Health Ministry, over 41,000 people have died and an estimated 1.9 million have been displaced. Now, faced with food, fuel and electricity shortages, compounded, of course, by lack of medicine and aid, civilians bearing the brunt of the war. Well, joining us now is James Elder, who's spokesperson of the United Nations Children's Fund, UNICEF. Thanks very much for joining us on the programme. I mean, much of the attention in the last week or so is turning in this conflict, isn't it, towards that situation in Lebanon, the conflict now between Israel and Iran. Bring us up to date, though, with what is happening still in Gaza, can you?
Yes, Stuart, you're absolutely right. The challenge, of course, is that it's impossible to disentangle the two conflicts. And as we've been saying for such a long time, a ceasefire. Surely any ceasefire in the Gaza Strip is going to help de-escalate what continues to spiral out of control everywhere else. Look, I was in Gaza last week. Your pictures tell the story. It is plunged into a much darker reality, I think, than anyone ever thought possible. I mean, you've now got 85% of the Gaza Strip under some sort of evacuation order. So whilst people have lost their homes and their livelihoods, when we say lost their homes, Stuart, of course we mean, and I've spoken to scores of families like this, the family who spent years and years or decades, like any family, saving and saving in brick and mortar, and then in a flash, their home, their apartment, utterly devastated, and they move 3 or 4 times. Every time losing something might be a possession, it might also be a loved one, and they are now crammed in less than 15% of the Gaza Strip. So your sanitation system, your water system, all those things, Stuart, we warned about disease on the ground. That's why we saw polio. So yes, people have been pushed into a level of suffering that is beyond what any child, any civilian should ever endure, and yet it's ongoing.
What would you say is the worst problem now? Is it hunger, is it food, or is it that lack of medicine?
It's impossible to separate. It sounds. Look, the biggest problem still is the bombardments. We've had half a dozen schools struck in the past week or so, schools acting as shelters, scores of children killed. When I was there last week, again, the very first day I was at a hospital, 4 siblings arrived, 4 young siblings arrived, children, all dead. The hospitals remain like war zones in terms of the sheer scope and scale of children with these grotesque wounds of war. Little boys and girls with shrapnel that is designed to rip through concrete, with burns. I didn't know that there was such a thing as a 4th-degree burn until I met a little boy, Hamid, who had 4th-degree burns. So yes, it's the bombardments, but yes, then you're in those hospitals, and doctors, despite heroic efforts, doctors, nurses, volunteers, lots of volunteers, they don't have the anaesthetics. They don't have the antibiotics. Doctors tell me that patients simply, we hope their bodies can fight off the disease. But you're still right to point to that wider humanitarian level of aid that people need. Food, water, and yes, medicine. There was so much global discussion when we were really on the cusp of famine in April, May, about what was being allowed in and more access points and what the occupying power Israel was and wasn't allowing in. That conversation seems to have stopped now, and yet August was the worst month since this war began, the worst month for humanitarian aid. So, the suffering has stretched the limits of beyond what people can endure. And yes, they are now as short of food, water and medicine as we've seen since this war started, and they know that winter is coming.
Yeah, that was going to be my next point. Winter is coming. How much worse could that make the situation there?
Yeah, I think... Well, so much worse. People's tents are frayed, it's wear and tear. Again, based on the delays and the restrictions and the denials and the lack of entry points and the lack of security for delivering aid on the ground, all of these things that sit a clear responsibility with Israel. Because of those things as well, right now, in terms of all the winter requirements that people need and that we know how to get it to those people, it'll take, 6 months or more to get these supplies to people. So winter is terrifying for people. And also, because they're shattered. It's hard. It's hard to explain the mental state of people, and I mean that not just through talking to them, but also because when I was there most recently, speaking to a child psychologist, trying to get an understanding of this uncharted territory we are for people, for families. Mums and dads are the front lines for children, but mums and dads have got nothing left. And this child psychologist said to me that she feels close to having a breakdown, but she has to try and stay strong because she's dealing with just hundreds and hundreds of children. So families need psychological support. They need tents. They need clean water. We saw a polio outbreak. In a place where vaccination is seen as so important by Palestinians, that only occurs because of the absolute devastation of primary health care. We warned of this. We warned again. These warnings are going unheeded, and it is again civilians and children who are paying the gravest price.
Where are the lines for you? What are you able to do? What aren't you able to do, bearing in mind the inevitable restrictions that there are to you operating freely?
Yeah, I mean, it's probably the most dangerous place to operate as an aid worker. If I look at my agency, UNICEF, look, we have managed to completely upscale some of our work. Thousands of toilets built. The polio campaign brought in 1.2 million vaccines of polio. Almost we've reached now 1 million people with some sort of cash assistance. That's critical because the economy and their agriculture has been devastated. We're getting medicines in. So we've consistently increased based on just navigating some of this chaotic system. But it's not enough because every single day we see more and more people displaced. Every single day we see more and more families, pushed past the edge. So yes, we are able to do what we're able to do what needs to be done, but not at the quantity that's needed. And there's something very, very sad about when you look into a parent's eyes and all they need is eardrops for their daughter or antibiotics, or a mother who was in tears because her husband had just killed, and she was in tears at a hospital with me, simply looking for a tent. And we have those tents. We need to get them in. So the United Nations is doing a huge amount, Stuart, but commercial trucks, which also were a backbone of aid coming in, or of supplies coming into the Gaza Strip, have been greatly restricted. That puts enormous pressure on civilians and pressure on the United Nations to go even above what they're able to do in these operating environments.
So just briefly, what initially in those first moments do you need at this stage? Do you just need to be able to get more aid in, presumably through the Rafah crossing?
Spot on, absolutely. The Rafah crossing was the lifeline for aid into the Gaza Strip, and it's been closed since May. So that is an absolute disaster for people. So we need more entry points. We need more roads. There is one road we are allowed to use in Gaza. Now, when you're cramming 2 million people into 15% of the land, and then that is the only road we're allowed to use, you can imagine what it's like trying to drive trucks and trucks through, tens of thousands of people. So more security on the ground, more roads on the ground, and we've seen that's feasible, and then just less obstructions. I have sat at checkpoints for 6, 7, 8 hours. There's not a single colleague who hasn't done the same thing. Sometimes we're made to wait until near dark time, knowing full well we can't do an aid delivery at night time, so we'll have to turn around. These kind of things have no purpose whatsoever other than to restrict and to delay aid to long suffering civilians.
Good to talk to you on the programme today. Thanks very much for joining us. James Elder there, who's a spokesperson for the United Nations Children's Fund, UNICEF. Thanks very much.